Hi, I'm Julie Saunders. I'm the director here at Provena Covenant Medical Center. I cover the floors of critical care and cardiac services. I also oversee education for the nursing staff that come here, and I also look and help with the flow of how patients come through the ER into the beds and best utilize the beds for the best patients that can benefit from that. Our nursing environment is both nurses and healthcare techs. Nurses do get one-on-one, and there are times when you would be able to completely care for the patient, from doing the bath all the way to making the critical decisions and giving the medications. But most of the time, some of the bathing and bedside care is provided by healthcare techs, and nurses are collaborating with the physicians as well as giving medications and overseeing the treatments and the overall holistic part of the patient's care. I think, given the healthcare environment that we're in, I think we have already seen this. We're going to have to do more with less. So we really have to look at how we can provide the very best care and not have such a burden to society in terms of the product that we are able to give. So one of the things nurses are going to have to do is find ways to provide care with less in terms of maybe your resources or even the amount of patients that you're expected to care for. At this point in time, we work really hard to make sure that our ratios are at the most on the floors 4, maybe 5. With healthcare techs, I think nurses in the future, and I'm talking on down the road, are going to have to find more of the healthcare tech or helper kind of people to take on a lot of the roles, and the nurses will be doing more critical thinking, meds, and overseeing. That's my prediction for the future, just because society requires us to do more with less. I am a instructor for University of Illinois. I have been for 10 years, so I teach the med-surg groups. I see a lot of them come into the hospital, and they have worked other hospitals during their clinicals. And one of the things I hear them say all the time is that they feel the mission in this hospital. They feel the caring. The people who work here have a real close relationship. They're here because they want to give health care to the community, including those who may not be able to pay for it. I know that I have had several students tell me that it's that feeling of closeness and the mission that draws them to this hospital.